My name is Dr. Andrew Cooper. I'm a board-certified orthopedic surgeon specializing in hip and knee replacements. Total hip replacement is where we replace the entire hip joint. That is both the femoral side as well as the socket side or the pelvic side. This is one way that we treat, or the most common way we treat hip arthritic conditions. It is an excellent surgical procedure for hip arthritic problems, and it requires a surgical management where we address both sides of the hip joint. Hip replacement surgery has been going on for multiple decades, and there's been a lot of recent advances that have improved this procedure. One of the major improvements in hip replacement surgery is the use of implants that do not require cement. These type of implants could potentially have a lifelong bond that could increase the longevity of a hip and knee replacement. Furthermore, there's been better techniques to reduce some of the complications of hip replacement, such as dislocation and surgical recovery time. Lastly, computers can be used in the operating room that can further improve the accuracy of hip replacement surgery. All of these improvements, both on the technological side as well as the surgical side, has reflected into improved patient outcomes. Total hip replacement is necessary when a patient clearly has end-stage arthritic condition, and it's clear that's what's causing the pain. Hip arthritis is often a condition that deteriorates quicker than knee arthritis. It usually takes less time for someone who has hip arthritis to end up having a hip replacement secondary to the increased disability. Patients often know when they need a hip replacement because they have a significant amount of daily pain and a difficulty in walking. The most common reason people come into my office seeking hip replacement surgery is inability to walk comfortably. People have noticed over time that they're limping more, their friends are noticing they're limping more, and they can't do the things that they like to do due to the stiffness and pain. When you start having hip arthritis, it becomes very clear that you're having more and more problems with your gait, and this often reflects into more and more problems with pain. Candidates for total hip replacement or all replacement surgeries tend to be related to both the health of the patient as well as the confirmation that the diagnosis of hip arthritis is what's causing your pain. Certainly a lot of things can cause problems in the leg, and it's first and foremost important to determine this is why you have pain. If this is why you have pain and you're a good medical candidate, hip replacement is an excellent option for your pain. My advice for someone who needs hip replacement surgery is to ultimately seek attention. This is obviously not an emergent problem, but if you're continuing to have more and more pain in your hip, it's probably good to get an x-ray to determine if this is the cause of your pain. If it is the cause of your pain, it's always a discussion of what your options are. Surgical management is always in your hands, and it's only something after a long discussion with your physician.